Hi, my name is Ken Hughes. I'm a licensed insurance broker with Great Nation Insurance, and I'm trying to contact you about a little white card you recently filled out and mailed back to me requesting some information on your upcoming enrollment into Medicare. Now, this is just going to be a really quick video, go over the basics of Medicare and what you need to do to get enrolled. Now, if you have any questions that I don't go over in this video, please give me a call, 918-857-6546. I'd be more than happy to go into greater detail with you. Now we're going to take a look at some slides here. So when you turn 65, as long as you or your spouse qualified for Social Security, then you should qualify for Medicare as well. The first two parts of Medicare I want to talk about is Medicare Part A and Part B. Medicare Part A is your hospital coverage. Now, this takes care of any kind of inpatient hospital stay, like at a regular hospital or a skilled nursing facility, a nursing home. I think of it as anything that happens inside the hospital is going to be taken care of by Medicare Part A. And as long as you do qualify for Medicare, Part A is free. Now, Medicare Part B is going to be your medical insurance. And this takes care of things like regular doctor visits, preventive health services, ambulance rides, lab work. Basically, think of it as anything that happens outside the hospital will be taken care of by Medicare Part B. Medicare Part B has a monthly premium of $148.50. And for most people, this is taken directly out of their Social Security check. Now, if you have decided to not draw Social Security when you turn 65, you can pay your Part B premiums quarterly directly to Social Security, and it's $445.50 per quarter. Now, Medicare Parts A and B together will pay for 80% of whatever your doctor or hospital bills come to. So that's going to leave you responsible for that remaining 20%. Now, you got a couple of options to cover that 20%. You can either get a Medicare supplement or you can get a Medicare Advantage plan. Now, the option that I prefer is a Medicare Supplement Plan G. And right now in Texas, those are running somewhere between $105 and $150 a month, depending on what zip code you live in. And the way the Plan G works is there is a yearly $203 deductible. And once that deductible has been met, everything after that will be covered at 100%. So if you have medical bills that come to $1,000 or $100,000, you're only going to pay $203. Now, another good thing about getting the supplement is you can go to any doctor or any hospital anywhere in the United States that accepts Medicare. And right now, that's about 90 to 95% of the doctors and hospitals in this country. Now, if you are going to get a Medicare supplement, they recommend getting that started 6 months before turning 65. Now, your next option is going to be a Medicare Advantage plan or Medicare Part C. And you've probably seen a bunch of commercials on TV for these. Unfortunately, they usually only talk about the good parts of these plans. These can get pretty expensive depending on how much you need to use them. You'll have copays anytime you go to the doctor, deductibles anytime you need a procedure done. If you're admitted into the hospital, you're going to pay your first 7 to 10 days of that hospital stay at about $275 a day. Most Medicare Advantage plans will have a maximum yearly out-of-pocket of somewhere between $5,000 and $7,000. Now, these plans you can get started 3 months before you turn 65. Now, as far as getting enrolled into Medicare, if you're already drawing Social Security, then you will be automatically enrolled into Medicare. And about 60 to 90 days before your birthday, you should get your red, white, and blue Medicare card in the mail. Now, if you're not receiving Social Security benefits yet, you're going to have to manually enroll yourself. And you can do this either online at this website right here. You can enroll over the phone at 1-800-772-1213, or you can enroll in person at the Social Security office. Now, right now, a lot of the Social Security offices are closed because of COVID, so you'll just have to check and see if yours is open in your area. Now, if you have a group health plan at your work, you are allowed to keep that after turning 65 and postpone your Medicare Part B. But you do need to compare what it costs to have that group plan compared to what it's going to cost to have Medicare and a supplement. A lot of times we find it's less expensive to go with Medicare and a supplement, or it could be the same price or maybe even a little bit more, but you get much better coverage going with the supplement and Medicare. Now, once you do not have that coverage any longer, you need to, as quickly as possible, get your Part B started, because you don't want to have any kind of a gap between when that ends and your Medicare begins. Now, Medicare is going to start on the first day of whatever month you were born. Now, if you were born on the very first day of the month, it's going to start the first day of the previous month. Now, the last part I want to discuss real quickly is prescription drug plans, or Medicare Part D. Now, these plans can be either very inexpensive, or they can also be very, very expensive, depending on the kind of drugs that you take. So you'll have to get with an agent, or you can go yourself online to medicare.gov, and you'll enter in all the drugs that you take, and then it will let you know what the best plan is for your particular situation. Now, this stuff you can't get started until you actually have your Medicare card in hand. Now, once you get your Medicare card, you can go ahead and get signed up for the Part D drug plan. Now, that's really all the time I have for this video. And like I said, if you have any other questions about Medicare or any of the stuff that was discussed in this video, please give me a call, 918-857-6546, or shoot me an email at medicareprousa@gmail.com. And thank you very much for watching my video. I really hope that it helped you. And again, if you have any questions, give me a call. Thank you so much. Have a great day.